I'm now pregnant spontaneously without after
Yeah.
surgery. So
Mm.
yeah, that's
Yeah.
good to know. Thank you.
Yeah.
So there's this question is um, can endometriosis be cured?
We haven't got a cure yet. We're basically just treating the disease, excising them.
Mm,
And if the women is still not planning to try for pregnancy, we put them on hormonal treatment to stop it from flaring up or from recurring straight until from recurring straight away until
mm,
they try for pregnancy. So as
mm,
much as possible, as far as we know, hormonal treatment limits the progression of the disease or recurrence.
mm.
And then when they start thinking about trying for pregnancy, they can stop the pill or whatever they're using, try for pregnancy. Once they've completed the pregnancy, they go back on the hormonal treatment. So that limits the window of opportunity for endometriosis to recur.
Okay. So in terms of the hormones, I know there are different preparations. Yeah. Any
Yeah.
preferences between the combined or the progesterone only pills, or it just depends on the symptom, the cost, the side effects, and the wishes of the woman?
It
What do you take into consideration?
basically it depends on the woman.
Yeah.
So we usually try the easiest, which is a pill. Usually, if they are young, their BMI is within below 30. They're below 35 years old. We would suggest a combined pill.
Mm.
And we would suggest either taking it 3 packets continuously.
Mm,
That's called a
continuously.
tricycling regime, or
Yeah.
they can carry it on without having a break until they get a breakthrough bleeding. And when I say breakthrough bleeding, sometimes when you take the combined pill continuously, you get a spotting. And when you get that for 2, 3 days, that means you have to stop,
Mm.
allow yourself to bleed, and then after 5, 7 days, you carry on taking where you left off with the combined pill. The progesterone only pill is also good. Again, it's in a pill form, so instead of having a break, you just take that continuously. And with hormones, there's always side effects, so it's a case of what the woman finds have less side effect for them.
Mm.
There's also the coil. I don't know if it's available everywhere, but there are
Yeah.
different types of coils. So
The
younger
marina,
women,
for instance. Yeah.
yeah. So younger women, I usually suggest something called JDIS. So it's the same as a Marina coil, but it's
Mm.
smaller.
Mm.
But again, a lot of these women, they look online, they see what feedback is or reviews are. They say, "Oh, I don't want that. I don't want that." So it's basically up to the woman. There's depot injection and there's implants as well. So it's up to the woman what they are comfortable trying to begin with. But sometimes we would try them on the least, the very basic, the pill. Then if that doesn't work, we put them on
Mm.
the Marina. But
Okay, that's good to
it's
know. How about
mm,
non-steroidals and even the opioids? Do they
yeah.
have any place in managing pain due to
Yeah, of
endometriosis?
course.
Yeah.
Yeah. So some women, they are not keen on hormones, so they can take something called mefenamic acid. So first
Okay.
they can have paracetamol, ibuprofen, but that's sort of commonly known, and they would have been using that already before they see us in clinic. So the next step up would be something along the lines of naproxen or mefenamic acid. They can use codeine with it, but what happens with codeine is that it can constipate. And if
Mm,
they already have bowel issues, they might not like taking codeine. And also, it's quite sedating for some. So, a lot of women who are working or driving or things like that, they don't like the sedating effect because it slows
mm,
them down.
mm,
And then, when they've already used codeine as well, we can build up to the next stage of dihydrocodeine or tramadol, things like that. But that
mm,
has to be reviewed in a consultant clinic, or they
mm.
might be
And it
referred
should
to
be a
the
doctor. Yeah,
pain
exactly.
management team. Yeah.
mm, mm. And then the other thing again, and there was this question that came in, if any role lifestyle changes in helping to cope with this pain,
Yeah.
like
So
weight
there's
loss.
a
Yeah.
yeah. So a lot of women that I've seen
Mm,
in clinic, they've managed their pain by modifying their diet. So some food could be inflammatory.
mm,
So it's a case of finding out what the food trigger is for certain. We're all different. So a lot of
mm,
women find that wheat and gluten can trigger
mm.
bloating, which
Oh, I see.
adds to their pain. So I tell
Yeah.
them to reduce wheat and gluten.
Mm,
Alcohol can also trigger some inflammation or irritation in the bladder if
mm,
they've already got bladder symptoms.
mm.
So eating less red meat, higher
Okay.
fiber fruit and vegetables
Okay.
helps
That's good
because
to know.
the harder it is for the bowel to work,
Mm,
the more it is difficult to work, and then it causes more pain. So things
mm.
like that. And there's something called low FODMAP diet. So
Okay.
you can look at online. That's
Mm,
usually a list of common inflammatory type food.
mm,
So it's a case of taking one certain type of food out of your diet for 4 to 6 or at least 4 weeks, and then reintroducing it, and then seeing if it triggers your pain. And
mm.
if it does, then you know it's a it's a trigger for you.
Oh, that's good to know. And and we've got this question again coming through.
Hmm.
And is there any role for physiotherapy for as part of the coping strategy for endometriosis pain?
There is a role for physiotherapy,
Yes.
but the problem is because things are flared up, when the
Mm,
physiotherapists go there and try to um, uh, release some of the tension in the pelvis, it could be quite uncomfortable. So
mm.
usually women don't want to do physio until after surgery. If
Okay.
their symptoms are managed by hormones, then obviously they can be referred to the physiotherapy team. But while they're in that state of flare up, sometimes physiotherapy can be quite uncomfortable for them.
Oh, okay. So it's good to know that, yes, especially uh, and physiotherapy can help, especially in women who have got tension in their pelvic floor muscles, for
Yeah,
instance,
exactly.
coexisting,
Yeah.
and that potentially can be
Mm,
beneficial to them.
mm.
And how about belonging to a support group? Do you think that is something which and that should be advocated for, supported?
Yeah, yeah,
Yes.
yeah. That's very important because we're
Yeah.
not all about
Yeah.
medicine and surgery.
Mm.
Anything that can help, that can support a woman with endometriosis, will really be
Help with
useful
the
for
pain.
them. Yeah, because sometimes they've tried everything and that's it. They just want to talk to somebody about their experience, and sometimes it helps them find out more. They share experience, they share what they've tried, what sort of different diets and sometimes I can't know everything, and I learned so much from the support group because this is what they've tried. They try natural remedy for
Yeah. Mm.
certain PMS symptoms, or if
Mm.
they are on the pill and they get side effect, they try natural remedy to combat that side effect, and it's quite helpful. A lot of the women, I run a support group for the
Oh,
trust
good.
as well, and
Mm.
they really like continuing to go to the support groups.
Oh, that's good to know. And basically, that's what informed what we're doing. I mean,
Mm,
is to give platform to women
yeah.
and people generally suffering from pelvic pain,
Mm,
and to get to share their experience and learn from one another. Yes,
exactly.
yes, and hopefully that will bring some relief. Yeah, and I know pain generally has a significant psychological component and even emotional component,
Yeah.
and often what we see as manifestation of physical pain could just be an unresolved emotional conflict in the background.
Mm.
So, do you find any psychological intervention, like maybe what we call talking therapy,
Yeah.
CBT, cognitive
Mm.
behavioral therapy,
Yeah.
useful in this women as a coping strategy for the pain?
Yeah, yeah, certainly. So usually after surgery, if the pain is still not manageable, even after
Mm,
they've gone on to hormonal treatment, or if they don't want to go on hormonal treatment,
mm,
we refer them to the chronic pain team. The chronic pain team have um, psychologists that they can be referred to. They sometimes offer hypnotherapies, so the psychologist is the one that referred them on to CBT. Although saying that, I can also write to the GPs and see if they can refer them to their community, um, if they have a community form of CBT, rather
mm,
than go through the trust, because the waiting list for the pain team is quite long as well.
mm. So definitely psychological intervention
Yeah.
can be very useful.
Mm, mm.
Yes.
And
Nice.
also there's
Yeah.
psychosexual counseling as well,
Okay.
although they
What does
have
that
to.
entail usually? If you can
Yeah.
give us some more information.
Well, we don't offer that, unfortunately, in our trust, but they can be referred to. There's someone in Royal Surrey, or they can ask their GP where they can be referred for psychosexual and counseling.
Hmm. Oh, that's good to know. And so we have a question and just came through. I mean, after treatment for endometriosis with surgery, we know for sure some women will have relief from the pain symptoms which they are experiencing. And does it really recur? I mean, after removing it in surgery in the
It
future?
varies. Yeah,
Yeah.
it varies. So some women, they feel really well, or even if they still a little bit of pain, I don't promise them 100% that pain's going to be gone, because that's impossible. But if they come back and say, "Oh, I don't have any pain anymore," that would be a great outcome for us. But if they do and it's manageable, then they can go away. They can continue taking their hormonal treatment, or sometimes they don't even want to try hormonal treatment. They just want to see how long they can last without hormonal treatment before going on hormonal treatment. And that's fine too. I can see some women coming back in sometimes after a year or a year and a half with their pain, because sometimes the severe cases, I keep an eye on them for 2 years, as per BSGE guidelines. But the ones with mild to moderate disease, sometimes I don't hear from them until 2 years, 3 years after they've had their children, and then they say the pain is still there, or it has come back, at which point they're ready for a hysterectomy. That's that sort of the scenario that comes back to me.
Mm, mm. Oh, I see. I see. So it's possible it can happen again in the future,
Yeah.
even after treatment.
Mm.
And uh, a quick question. Does endometriosis affect the menstrual cycle? I mean, does it make the period heavy?
It sometimes could. So in some cases, when the endometriosis is in the muscle of the womb, it can
Mm,
make the periods heavier, and
okay.
it can make the periods more painful, just
Okay.
because the womb itself.
Adenomyosis,